Maxillary and mandibular tori, a literature review. Before starting, I would like to express my appreciation and gratitude to Dr. Nawar for her efforts and continuous support. Introduction. Turus palatinus and turus mandibularis are two of the most common intraoral exotoses. Other types of exotoses that are affecting the palatal aspect of the maxilla, palatal exotosis, or the buccal aspect of jaws, buccal exotosis, are less commonly encountered. Turus palatinus is a sessile nodule of the bone found only in the midline of the hard palate, while turus mandibularis is a bony protuberance located in the lingual aspect of the mandible, commonly at the canine and premolar area. Although the tori are not pathologically significant, they may obscure radiographic details of maxillary sinuses and lower premolars. They also interfere with the construction and function of the removable dentures, as well as oral function and movement. Maxillary tori definition. Turus palatinus is a harmless, painless bony growth located on the roof of the mouth, the hard palate. The mass appears in the midline of the hard palate and can vary in size and shape. Maxillary tori are asymptomatic in most cases and not require any intervention. Palatal tori are the most common oral exotoses, more common than mandibular tori. The average prevalence of palatal tori seems to be 20 to 40%, with a predominance of palatal tori in women and larger in size than in men, although it may be present in children. Here we have a picture of a palatal tori. Types of maxillary tori. The tori are categorized by their appearance into flat tori, are located in the midline of the palate, and extend symmetrically to the either sides. Spindle tori have a ridge located at their midline. Nodular tori have multiple bony growth that each have their own bases, and lobular tori have multiple bony growths with a common base. Here we have A picture for a flat tori, B for spindle tori, C for nodular tori, and D for lobular tori. Etiology of maxillary tori. The etiology of the AMT is usually multifactorial, which include genetic factor, masticatory forces, and parafunction could be all factors in their development and growth. Diet also one of the causes of the AMT. Turus palatinus most prevalent in countries where people consume a large amount of saltwater fish. Saltwater fish contain a high amount of polyunsaturated fat and vitamin D, two important nutrients for bone growth. Also, there is a connection between the pressure placed on bony structure in the mouth when there is a grind and clench on teeth and the appearance of AMT. Clinical feature and diagnosis of maxillary tori. Turus palatinus doesn't have any pain or physical symptoms. It can have the following characteristic. It is located in the midline of the roof of the mouth. It varies in size from smaller than millimeters to larger than 6 millimeters, and it can take a variety of shapes as we talked previously. The diagnosis of palatal turus is done clinically, but pathological examination might sometimes be useful. They are most often covered with a mucosa that appears normal, thin, and hypovascularized, which includes sensitivity during trauma, often causing ulceration or inflammation. Complication and treatment of maxillary tori. One of the complications of AMT is interfering with the denture fitting or interferes with eating, drinking, speaking, and good dental hygiene. Maxillary tori causes trauma because it is crushed with the food during eating and lead to ulcer due to repeated trauma. Patients with MT are complaining from sensitivity because of the thin mucosa covered palatine torus. Treatment for torus palatinus isn't usually recommended unless it's interfering with normal function, so surgical treatment is the most common management suggested for palatal tori. Torus mandibularis definition. Torus mandibularis is a bony outgrowth composed of compact bone, densely mineralized, usually without medullary cavity, located on the lingual side of the mandible in the canine or premolar region above the attachment of the mylohyoid muscle. The size of the tori may fluctuate throughout the life. The growth of torus mandibularis is very slow and may stop spontaneously, and in some cases the tori can be large enough to touch each other in the midline of the mouth. As we see in this picture, they almost contact with each other. Types of mandibular tori. Mandibular tori, as maxillary tori, can be categorized by their appearance and shape as flat, spindle, nodular, and lobular type. Here we have the picture in sequence: A, the flat tori; B, the spindle tori; C, the nodular tori; and D, the lobulated type. Etiology of mandibular tori. The torus is considered to be a developmental anomaly, although it does not present until adult life and often will continue to grow slowly throughout the life. Torus mandibularis is thought to be caused mainly by environmental factors, which include vitamin deficiencies and calcium-rich supplements. Also, mandibular tori are the result of bruxism and local stresses due to the torquing action of the arch of the mandible. Genetic factors play a key role in this condition. It is more common in men than in women, so can be passed down from father to son. Clinical feature and diagnosis of the torus mandibularis. Torus mandibularis present as a bony growth beneath and on the side of the tongue, appear as one growth or multiple growths, and they can develop on one side of the mouth or on both sides. It is usually asymptomatic. All these are notes clinically, but sometimes identified on computed tomography (CT). Mandibular tori on CT present as bony protuberance as dense to compact bone and typically located on the lingual aspect of the mandible. So, radiographic examination are very important for diagnosis. The differential diagnosis of torus mandibularis include abscess formation, bone cancer, salivary gland tumors, vascular tumor, and fibroma. Here we have image for mandibular torus. Torus mandibularis complication and treatment. Torus mandibularis can sometimes cause problems such as pain or paresthesia. Torus mandibularis can interfere with denture, may be uncomfortable, and may not stay in place. The soft tissue that covers the growth can also become ulcerated in some cases. Torus mandibularis not need any treatment unless it becomes so large that it interferes with function or denture placement or has recurring traumatic surface ulceration. The medullary bone beneath an ulcerated torus may be completely necrotic. Surgical removal may be required for torus mandibularis. The surgical site may not heal because of leaving a large area of bone exposed for months, possibly for years. Therefore, more conservative measures are first recommended, such as gentle debridement and topical antibiotic treatment of soft tissue at the edge of the exposed bone. Conclusion: torus, or tori plural, is a benign bone growth in the mouth, classified according to their type into flat, spindle, nodular, and lobular type. Mandibular tori seen on both sides of the oral cavity. Both maxillary and mandibular tori are asymptomatic but sometimes result in complications such as interference with speech, tongue positioning, prosthetic reasons, poor oral hygiene, and traumatic ulceration of mucosal surface. My thanks and gratitude to the respectable discussion committee, Dr. Omar and Dr. Ban. Thank you.